Welcome back, viewers, to Faith and Discipline podcast. Our topic today is prostate cancer, and our guest is Dr. Mazhar Sheikh. He is consultant urologist. Welcome, Dr. Mazhar Sheikh, to Faith and Discipline podcast.
Thank you very much for the opportunity.
Let's make a start. So, what is prostate gland, and where is it located?
I think it's a very excellent starting question. So, prostate gland is a gland which is placed between the water pipe called urethra and bladder. It is present in every male patient. So that's what it is. So as far as location is concerned, normally it is about 20-25 grams, and it increases in size. Multiple factors are involved, and it can have an impact on quality of life and symptoms.
Okay. So before we start going towards prostate cancer, let's have some questions regarding BPH. So what is BPH and what are the symptoms?
So benign prostatic hypertrophy is the abbreviation of BPH. H actually stands for hypertrophy, which means it's the enlargement which when look under the microscope. So now we use the term hyperplasia or enlargement. So as men grow older, under the influence of male hormone testosterone, prostate enlarges. Many of the time you don't have any problem, but you can have, with the enlargement of prostate, you can have an effect, and that works as symptoms.
Okay. What is the reason of BPH? Why it happens?
As male grows, as we age, our prostate enlarges because of the imbalance between the male hormone testosterone and estrogen. So testosterone works as the feeding seed for male prostate to enlarge.
Okay.
So that's a very normal aging process.
Okay. So if we talk about particular symptoms, like what happens, what patient experiences when they have BPH?
So the way I explain to my patient and general audience is the bladder and the prostate, they are the two factors that can help and contribute to the waterworks. So bladder, which is a reservoir and a pump, and prostate lies at the outlet where the urine comes out. So if you're thinking about the waterworks, they are dependent on two types of symptoms. One is storage symptoms, which means if you have frequency, urgency, or getting at night, or you have voiding symptoms, which is basically if your flow slows down, you go very often, you have the feeling that you're not emptying your bladder completely, or you have intermittency. You go to the toilet, you want to feel it again, want to go again. And the last one is the straining. So you have to strain because the prostate enlarges and put the pressure on the bladder to work harder. So this is how I ask my patient to think about the symptoms. So they are voiding symptoms, which are predominantly the flow and straining, and the storage symptom, which is basically urgency, frequency, and getting at night.
Okay. So what is the main difference between BPH and prostate cancer?
Excellent question. So I think many of the patients do concern about if they have enlarged prostate and having symptoms that they have cancer. However, we need to be very careful about diagnosis of prostate cancer. In UK, the studies have shown it is one of the highest prevalent cancer among the men. In fact, 1 in 8 men can have prostate cancer. So one of the way that the prostate cancer can present with the prostatic symptoms. So that's why if you have any symptoms, like you're going very frequent, if you have blood in the urine, anything like, it's better to get the advice rather than just lingering on waiting too long.
Okay.
Yeah.
Right. So at what age normally patient experience the BPH?
Can you have a very good question. There are multiple factors, but studies have shown under the age of 40, the prostatic enlargement is not significant. However, if there is other factors that can contribute and mimic as prostatic enlargement. Suppose if you have a narrowing of the water pipe, if you have a stone, they can also mimic that you are having prostatic symptoms. There might be underlying cause for that. So normally under the age of 40, prostatic enlargement will not be very significant.
Okay. So is there anything we men do to stop and prevent BPH?
There are few studies which have shown there are few herbal products that can help. Evidence is equivocal. So if you look at it, there is a product called Potaba based which can help to reduce the prostate volume. What I tell my patient, apart from looking for the medication, modify your lifestyle. Many of us drink a lot of caffeinated drinks, fizzy drinks, stuff like that. If people are constipated, they would have a symptom effect. So these are the things that we need to look, which we as men can control. Healthy, balanced lifestyle, exercise, weight reduction, reducing the irritant to the bladder.
Okay.
And despite doing, there is a problem, then we have few things. So there are a few products that can be helpful. Yeah.
Okay. So is BPH is like a benign type of problem, or it can lead to serious health conditions?
Prostatic enlargements predominantly is the benign enlargement, so it's a non-cancerous growth,
Okay.
but there can be overlap.
Okay.
But you can't say like if you have benign large prostate that can lead to cancer. No, there is no evidence.
Okay, no evidence. Can BPH interfere with quality of life of the patients?
Absolutely, it can.
Okay.
So that's why I tell like it's not if you have enlarged prostate or not. It's basically are you affected?
Okay.
It is affecting your quality of life. That's the aptitude that you should have towards the benign enlargement of prostate.
Okay. What are the treatment options available for BPH, and do they actually work, or is it just to manage the problem for lifelong?
Because what we know as the men are aging, prostate enlarges. So about predominantly about 30% of the patient would definitely require some kind of intervention. Many of the time we can control them with lifestyle modification and those things that I have mentioned earlier. However, there is a role of medication, there is a role of less invasive option, and then surgery.
Okay.
So these are now about 30 years ago, if we don't have many options, prostate shaving or TRP was the standard of care. Now we have less invasive option available apart from medication.
Okay. There are some, shall we call them medications or call them like treatment options available. People are buying from the internet, Actiflow or beta-satisterol, that type of things. Do they actually work?
I always ask my patient, look, I discourage prescription or over-the-counter or online pharmacy, because prescribing should be a balanced process which involves patient has the right to know what are the side effects, why are we taking, what are the alternatives. So because nothing is magic, it takes time to resolve. So there are medications. So I encourage my patient, in fact I strongly advise, don't start medication, see a professional and take it from there.
Take it from there. Okay, that's good advice. There might be a time in a patient's life when they are the condition is so bad, it's a urinary retention, they can't empty the bladder. If that happens, what is your advice? What they need to do?
So acute urinary retention is a urological emergency. So they need to seek advice on urgent basis. So if they are not emptying the bladder, they are in pain, they need to someone and should be referred to the emergency department for catheterizer or emptying of the bladder. Because if it's kept too long, it has these adverse effects. Worst scenario, you can develop kidney failure, you can develop stones, you can have worsening or sepsis. So these are the factors, so the acne should not be taken casually. So there's another condition called chronic retention. So people are passing urine but they are not emptying. So that's a different topic. But acute urinary retention should be addressed as acutely.
Okay. So after discussing BPH, now move on to prostate cancer. Are the symptoms of prostate cancer same as BPH, or is there any difference?
So prostate cancer can have presentation with BPH symptoms.
Okay.
However, it can present, the commonest one is if you have new onset of waterworks problem, if you have seen recurrent blood in the semen, if you have a family history of prostate cancer, and your blood test called PSA has been done for a reason, after proper counseling it is high, that needs urgent assessment. Yeah.
Do we know the exact reason behind prostate cancer?
So there are multiple hypotheses. So if you say, is there one reason on which we can say? So there is no one reason. So the studies have shown, especially the post-mortem studies, that anyone who, as we grow older, chances of prostate cancer rises. So somebody in our age group, the risk of significant prostate cancer about 10% or so, whereas somebody who is in the 80s, 80% could have prostate cancer. Okay. So as we growing older, that's the established fact, prostate cancer is more prevalent among the aging population. Okay. If somebody has the family history, that increases the significant risk. So if one family member is involved, there's 2 times risk, and if 2 family members, 4 times or so. Okay. Afro-Caribbean population have a higher risk of a problem. So there are risk factors related to genetics, race, and other factors.
Some of the diseases, there is a link between the disease, diet, and lifestyle. Is prostate cancer or BPH got something to do with diet and lifestyle?
I think this question has been addressed at multiple levels, and there are studies who shown that if you have a higher BMI, if you're obese, the risk of prostate cancer can increase. But they are not, they are more like longitudinal studies, or they are studies that observational studies. So there is some relation reported with the high BMI or obesity with prostate cancer, but not very concrete.
Not very concrete.
So genetics and family history is the one.
Is there anything to do with diet?
Diet, again, I won't say like, I suggest there is no obvious reason on which we can say if you eat that much, but studies have shown a high animal fat diet against the same high BMI, that again observational sort of thing.
So how serious prostate cancer can be for the patient?
It can be. It can be something that can really compromise your quality of life and the well-being, along with the people involved in your care. So prostate cancer, if you detect it early, it can be treated with intent to cure, very minimum side effect or impact. However, if you are presented late, you can have fractures, you can have cord compression, you can have metastasis that affect the colon. So it can have significant impact.
Some people talk about prostate massage as a treatment option to relieve the symptoms. Do you recommend that? And is it something like really, as a real thing, or is it just a made up?
I think it's another very good question, because there is something which we call evidence-based. The other is called myth. But it can help, but patient needs to be counseled. It may work, may not work. They are basically for chronic prostatitis, where we go to prostatic massage, and the best outcome is if you do it under general anesthesia, because it will be very uncomfortable. So proper counseling and then take it. It may help.
And for patients who suffer from BPH or prostate cancer, does it interfere with their sexual life?
It can. So benign prostatic enlargement basically is not causing direct effect on sexual life, but it has an impact, because think about it, if you have trouble with the waterworks, your well-being is compromised, and as we grow older, our erectile function are compromised. So it can present. For prostate cancer, it can if somebody has a new onset erectile dysfunction, it wasn't like that. I think it's better to seek advice to be assessed properly.
As a part of the procedure, through surgery, the prostate is being removed, partially or fully removed. Would it affect patients' quality of life? Does their water work normally, or is there any problem with that? Secondly, does it also affect their sexual life as well?
When we do an operation for benign enlargement prostate, we are not removing prostate. We are creating a channel. So when you're creating a channel, you need to be careful how you have counseled the patient. The evidence has shown if somebody has an operation for enlarged prostate causing slow flow, incomplete emptying, the success rate is 80 to 90%. However, if somebody has an operation for frequency, urgency, getting at night, the success rate is about 60 to 70%. So, and prostate can regrow. So we need to counsel them, and patients should have a clear expectations what they can achieve out of it. We use British urology leaflets for counseling the patient. It can affect up to 10% of the patient. And again, we need to know how their sexual function before the operation. It will not going to improve. It will going to disimprove. So we need to be careful. Not in everyone. So that's why again is the counseling and consent process. The patient should know what can happen.
So does it cause, when you say 10% patients are affected, does it mean causing ED or PE?
So premature ejaculation, or what I call in simple dry ejaculate, it will be experienced by almost all the patients who have TURP, because the valve mechanism which control the semen ejaculation and the waterworks are around the same area. So when we shave the prostate, do an operation, they will be compromised. So almost all the patients, especially if they are having a standard operation, have dry ejaculate. Regarding erectile dysfunction, as I mentioned, up to 10%, but it needs to be know what were the erectile function before the operation or intervention.
So to sum up, what is your overall recommendation? What people should do? People who are already suffering from BPH or prostate cancer, what they need to do? And for those who are not suffering from it, but they want to prevent the disease, what they need to do?
Okay. So first we go to the preventive side. So anyone, as we are growing older, we need to look into our lifestyle, modify those factors as I have alluded earlier. So that's the most important. If you are having new onset, blood in the urine, anything like, don't assume it's fine. Get your opinion from the expert. Your GP is a very good portal to take. And don't read too much on internet. The problem is the internet is very good, but it's the balanced information you need. Okay. So seek medical advice. If you have any symptoms, take it from there.
Okay, thank you very much. Today's session has been really useful, and hopefully we will join again for another topic. Thank you very much. Thanks for your time.
Thank you very much.
Thank you, viewers, for your time. If you found today's session useful, you can share with your friends, and you can subscribe to our channel for more useful content. We intend to do this podcast live in future, where we'll like to take your questions and we try to help with any symptoms you have. Thanks for watching.